Hi everyone, I'm Donna Wells with CDHA. This question and answer session is on the structure of care calls and is part of a video series produced by CDHA to assist dental hygienists in having positive conversations with employers as they return to work post-COVID and to pursue collaborative relationships for healthier workplaces in the future. If you have not watched the introductory video, it would be a good idea to do so because it will help you better understand the frameworks that will be discussed. At this time, I'd like to introduce you to Catherine Eitel-Belt, a communication expert in the dental profession. Thanks for joining us, Catherine. Can you walk us through the process for making a care call?
Sure. So a care call basically is an outreach call to patients to let them know, number one, we're thinking about them and just wanted to check on them personally. So it's a human connection. That's the first purpose. The second purpose is potentially to have a proactive discussion about keeping their oral health at the forefront of their thinking and to help them feel comfortable about coming back into the office as soon as possible. So to do that, we're breaking the structure down into a couple of parts. The first part is to just check and make that human connection, to check on how they're doing, how they've been navigating this crisis. And I would love to point out here that we will always want to be calm and optimistic and positive, but sometimes they will be in a high stress frame of mind. So for example, maybe they've lost a job or their spouse has lost their job. Potentially they could have been ill with COVID or something else. Or someone they love has been. So it is possible that when we say, how are you? That what we hear is that they're not doing well. And I think if you get that response, you're just going to want to listen and be empathetic and bring your heart, you know. We don't have to have answers for their challenges necessarily, so don't worry about that you don't know how to advise them. We're not really making this call to advise them on their personal issues, but we are asking how they're doing, and it's enough, you know, Donna, to bring an empathetic ear and just let them know that we're sorry and that we are going to keep them in our thoughts and prayers, and we're going to check back with them as soon as we can to see how they're doing, if things are getting better. And I think that if it is a really high stress situation, that may be all you want to do. Maybe other than just saying, are there any questions I can answer for you at this time, that kind of thing. But I wouldn't go forward with a lot of proactive, you know, how's it going with brushing your teeth when, you know, someone they just knew passed away. So, you know, just use your good judgment here. But the majority of the people that we're going to ask that question of are probably going to say some version of, I'll just be glad when this is all over. You know, and so if they're not in a high stress situation or they don't have high emotions happening right now, then I think you can go to the next step, which would be to see if they do, you know, what questions do they have? How are they doing with their home care? How are they feeling just from a dental perspective? Are they experiencing any discomfort, or do they have any questions? And so that's why I think hygienists are so well suited for this, because you'll be able to not only understand their questions really well, but to give them some really sound advice around that, and to determine if some other action needs to be taken. Do we need to see them in the office, depending on what their issue is? So you'll have, you know, really good judgment about that. So really that's just checking in on home care, any other dental issues that they may be experiencing. I think it's great to offer some resources. So certainly if they're struggling with their home care, you may need to recommend a particular rinse that they can pick up at the grocery store or the drugstore. You might need to recommend a video. So, you know, just being prepared with those resources and offering them to them. Maybe there's an article or something like that that you can recommend, depending on what their questions are. And then lastly, you want to make sure that they know, or I shouldn't say lastly, two more things. You want to make sure they know that if they do have an emergency or have a need, how would they reach you? Who should they reach out to? What could they expect from us? And then I think it's a great option right here to offer that if they have a family member or a neighbor or a friend that has an emergency and doesn't have a dental home, that that you would be happy to help them as well. And lastly, I think we want to be proactive about just educating them very, very comfortably on how we're going to create a safe environment for them to return to, and how anxious we are to get back to caring for them, that we're really looking forward to that. So, to do that, you're going to need to know what your infection control protocols are going to be now. But assuming that you've gotten some decisions have been made in your practice about that, it would be good to begin to set their mind at ease that it will be safe to return, and all that you're doing to make sure that that's happening. So those are some of the categories. Check in with them, check on their home care and any dental related questions, offer some assistance and resources, make sure they know where to go in case of an emergency, make sure they know where to refer people in case of an emergency, and then make sure they know what you're doing behind the scenes right now to prepare to reopen safely and effectively.
Great. If the dental hygienist is looking at the schedule, who do you think they should be calling first?
That's a great question. I think we have to start with the people who've been affected by being closed, by the closure. So let's reach out first to the people, and the offices may have already begun to do this, but people that we already had on our schedule and we weren't able to see them because we had to shut down so quickly. Those would be the first people to contact and create these care calls for. Second would be people who have outstanding treatment plans. First of all, they're going to be the people we want back in our practice the soonest, right? We're going to want people that have treatment, that productive treatment, so that we can stay alive and get back on track in terms of our productivity. So we want to reach out to people with active, plus they're often more likely to be the people who will have dental concerns, will have some symptomatic concerns. And so, because they have active treatment plans. So reach out to those second. Thirdly would be to reactivate or reach out to people who are ready to be reactivated. So maybe they don't have an active treatment plan, but you've been routinely seeing them in hygiene, or they're due and they're not scheduled. Anybody that's sort of in your reactivation system without a current treatment plan, I think would be a great third choice. And then lastly, just consider some PR calls, I'll call it. Just maybe people who are at high risk in your practice, the elderly, people who've been sick, people who maybe have a struggle to physically get to the office. Check on them. I think those are the true definition of a care call, and we're going to want to have them in the loop as well. So I think, just go down create a hierarchy, and because you can't call everybody at once, so you're going to have to make some choices. So maybe make a system for who we're going to reach out to first and second and third, and then you'll be able to go through your list and identify those.
Any other recommendations you have? You've covered the structure of the care call, how to address infection control questions. Any other recommendations or suggestions you have as dental hygienists progress with their care calls?
Yeah, Donna, I think the only thing I would add is be prepared before you pick up the phone. Be prepared with a couple of things, such as specific resources. You don't want to be vague here when you talk to patients, because they won't take an action if they're confused. So if you're going to recommend a website, let's say you wanted to direct them toward these professional videos, so give them the specific web address to go to for that, or offer to email it to them would be another great option. Make sure you know what rinses are available in your local community or tools, dental hygiene tools that they could go and purchase if you think that might come up in the conversation. Things like your practice's plan for reopening. Get clear about that. Get clear about how you're going to be handling the enhanced PPE and your infection control protocols. Have a virtual session with your practice and get clear on what can I say and what kind of promises can we make and not make to patients, so that I'm really prepared for those questions. Also, review your patient's history and records to the degree that you can. You don't need to spend 15 minutes reading the whole chart, but just make sure that you've taken a glance at, what were your last few conversations? The last time you saw them, what was their status, so that you can just reference that and not be not be caught off guard. So, and then lastly, I would say be prepared with the structure. Maybe map out on some little bullet points the structure of your call so you can glance at it as you're making the call and you never feel lost or, you know, unprepared for it. So, and you don't want it to just wander. So if you have that in front of you, then it'll be a great guide. So just get prepared before you pick up the phone. But otherwise, these are pretty easy. They go. Patients on the whole really respond positively to these. They do feel like someone's thinking about them and caring about them, and you become a human to human resource instead of just another business and healthcare provider. So I think it really humanizes our profession, and that's what we're all about.
That's great. Thank you so much, Catherine.
You're welcome.